You will hear a conversation between a nurse and a patient. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Miller. What brings you in today?
Well, I work as a teacher, and everything was fine at first. But about 4 days ago, I started noticing some mild discomfort in my right knee. Initially, it wasn't too bothersome, but the pain has gradually increased since then. Now, it's becoming quite severe, especially when I move around or make any kind of movement. Even simple actions like walking or standing have become really painful.
And have you noticed any swelling?
Yes, there's quite a bit of swelling, particularly after I've been walking or on my feet for an extended period. It seems to worsen as the day goes on, especially if I've been moving around a lot. By the evening, my right knee feels noticeably more swollen and stiff, making it even harder to bend or move comfortably. I've also noticed that it sometimes feels warm to the touch in the swollen area.
I see. So just to clarify, which knee are we talking about again? And if you were to think about the pain, how would you rate it? Let's say on a scale from 1 to 10, where 1 is no pain and 10 is the worst pain imaginable.
Well, it's actually my right knee that's giving me trouble. And initially, I'd say the pain is probably around a 4, though I was a bit uncertain at first whether 0 was meant to represent the highest level of pain, or if 10 indicated that. But now that I think about it and clarified that 10 is indeed the highest, I'd actually rate it closer to a 7. It's not the worst pain imaginable, but it's certainly significant enough to disrupt my daily activities, especially when I'm moving or trying to go about my routine.
Just to make sure I'm getting the full picture, have you had any recent instance or perhaps an injury, even a minor one, that might have led to this pain you're experiencing?
No recent injuries that I can recall. But actually, I was diagnosed with osteoarthritis around 5 years ago, so I'm wondering if it could be related to that. Although it wasn't really bothering me until now, and I haven't had a flare-up in a while, so I'm not entirely sure. But it does seem like it could be connected somehow, although, again, there hasn't been any particular incident that triggered it this time.
So just to clarify, are you currently taking any medication to manage that? I mean, anything specifically for the pain or maybe even something else that might indirectly help?
Yes, well, I've been taking paracetamol minus 500 milligrams 3 times a day. It does seem to help a bit, although it's hard to say exactly how much. I noticed some relief, but it's really not as effective as I'd hoped. I'm not sure if it's because of the dosage, or maybe just the nature of the pain itself, but it's only providing minimal improvement. So while I am taking it regularly, it's not really making a significant difference.
Let me have a closer look at your knee. Yes, there's definitely noticeable swelling here, particularly around the joint. How's your range of movement? Can you try bending your knee for me just to see how far it will go?
It's quite painful when I try to bend the knee fully. I feel a sharp, almost stabbing pain as I reach a certain point, and it gets worse if I try to push past that. I can't bend the knee as much as I normally could. It feels stiff and restricted, almost like something is holding it back. Even everyday movements, like going up or down stairs or standing up after sitting, have become difficult. I don't have the same flexibility I used to, and the discomfort seems to increase with each attempt at bending the knee.
Everything you've described, the pain, the swelling, and the difficulty bending your knee, as well as what I can observe during the examination, it does seem like your osteoarthritis might be flaring up. It's quite common for osteoarthritis to cause inflammation in the joint, which could explain the increased pain and swelling you've been experiencing, especially after being on your feet. The inflammation could be contributing to the restricted movement and discomfort you're feeling with bending the knee.
So what should I do about it? Is there something I can do to reduce the pain or the swelling? Should I be adjusting my medication, or are there other treatments that could help in this situation?
For the time being, I strongly recommend that you rest and avoid any strenuous activities that could put additional stress on your knee. Try to limit movements that aggravate the pain, like bending the knee or staying on your feet for long periods. To help manage the discomfort, I'll prescribe you a stronger painkiller. I'm going to give you ibuprofen now, which should not only help with the pain, but also reduce some of the end inflammation in the joint. So if you don't notice a significant improvement in a few days, we might need to explore other treatment options, such as adjusting your medication or possibly looking into more advanced therapies like physiotherapy or even a corticosteroid injection.
All right, thank you. I'll rest and follow your advice. Hopefully the ibuprofen will help.
You will hear a conversation between a doctor and a patient. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Ms. Roberts. How can I help you today?
Good morning, doctor. For the past 3 days, I've been experiencing these terrible throbbing headaches that just seem to be getting worse with each day. It's not just mild discomfort, it's really intense to the point where I feel like I can't focus or do anything properly. I am an office worker, so I'm constantly staring at a computer screen, and that seems to be making things even more difficult. The pain is so overwhelming that it's affecting my ability to concentrate, and it's really starting to interfere with my job. And even simple tasks feel nearly impossible when the headaches flare up. I've tried taking over-the-counter painkillers, but they don't seem to provide much relief.
I'm sorry to hear that. Can you describe the pain? Since when you have it, does anything seem to make it worse?
It's definitely a throbbing kind of pain, almost like a rhythmic pulsing that I can feel in my head, and it tends to intensify under certain conditions. Whenever I move around too much, whether I'm walking, bending, or even making sudden head movements, the pain seems to escalate, almost as every movement triggers a new wave of discomfort. On top of that, exposure to bright light makes things much worse. Whether it's sunlight, bright indoor lighting, or even the glare from my computer screen, the pain becomes sharper and more unbearable. So it's like the light irritates the headache going further, making it hard to function normally.
Just to get a clearer understanding of the severity, if you were to rate the pain on a scale from 1 to 10, where 1 represents minimal or almost no pain and 10 signifies the worst pain imaginable, how would you describe the intensity of what you're feeling right now? This will help us gauge how severe the discomfort is and guide us in determining the best course of treatment.
So when the pain is at its absolute worst, I'd say it's around an 8 on the scale. It becomes almost unbearable during those moments to the point where it's difficult to concentrate or even carry on with regular tasks. At its peak, the intensity is so overwhelming that I just want to close my eyes and avoid any kind of movement or stimulation. It's not constant at that level, but when it flares up to an 8, it feels like I can't manage it without some form of stronger relief. There west, I've definitely noticed a heightened sensitivity to light, almost as though any bright light, whether it's from natural sources or artificial, feels harsh and unbearable, intensifying the discomfort in my head. It's as if my eyes can't tolerate even the slightest brightness without worsening the pain. Along with that, I've had bouts of nausea, though it comes and goes unpredictably. There are moments where the nausea feels quite strong, almost like I'm on the verge of being sick, but I haven't actually vomited. It's this persistent, uneasy feeling in my stomach that accompanies the headache, adding another layer of discomfort to what I'm already experiencing.
I see. Do you have any medical history related to headaches?
Yes, I've experienced migraines in the past, and they've become somewhat familiar to me over the years. Whenever I get one, it's usually quite debilitating, similar to what I'm feeling now, though this time seems particularly intense. Typically, I manage them by taking sumatriptan, which has been my go-to medication, but I find that it helps to alleviate the pain somewhat, though it doesn't always provide complete relief, and sometimes it takes a while to kick in. I usually take it at the onset of a migraine, and while it's not a perfect solution, it's been the most effective option I've tried so far.
All right, let me take a moment to assess your blood pressure. After a thorough measurement, it appears to be at 125/85 mmHg, which falls within the realm of what is generally considered normal. So this reading indicates that your blood pressure levels are within an acceptable range, suggesting that there are no immediate signs of any underlying health issues that could be of concern. In other words, based on this particular metric, it seems that your cardiovascular health is stable at this moment, and there are no apparent indications of anything serious that would warrant further investigation at this time. Based on the information you provided regarding your symptoms, the intensity of pain, and your sensitivity to light and accompanying nausea, it appears that you are indeed grappling with a severe migraine. This condition often manifests with debilitating headaches that can significantly impair your ability to function, and given the history of similar episodes you've experienced in the past, it aligns well with the characteristics of a typical migraine. The level of discomfort you've described, coupled with the other symptoms, to strongly suggest that this is not merely a standard headache, but rather a more complex and acute migraine episode that warrants careful consideration and appropriate management.
What can I do to feel better?
I will be prescribing ibuprofen to help alleviate the pain you're currently experiencing. So this medication is effective in reducing inflammation and providing relief from headache discomfort. In addition to taking the ibuprofen, I strongly recommend that you take time to rest and allow your body to recuperate. It's also crucial to stay well hydrated, so please make sure to drink plenty of fluids throughout the day, as dehydration can sometimes exacerbate headache symptoms. Furthermore, I advise you to minimize exposure to bright light, which can trigger or worsen your symptoms. Consider resting in a dimly lit or dark room, as this may provide additional relief and help you feel more comfortable while you recover.